Good afternoon, class. So today we will talk about blood vessels and circulation or ang circulatory system naton. Okay, so this is our last module 16 para sa period 2. Okay, so circulatory system. So meaning, studihan tadi kung paano mag-circulate ang blood sa aton body pakadto sa different parts ng aton nga body. Okay, so circulatory system is constituted by two classes of blood vessels. So we have pulmonary vessels, systemic vessels. Sa pulmonary vessels, transport blood from right ventricle of heart through lungs and back to the left atrium. And the systemic vessels transport blood from left ventricle through all parts of the body and back to right atrium. So, ang major functions ng aton nga circulatory system, it carries blood, exchanges nutrients, waste product, gases with tissues, transports substances, helps regulate blood pressure, directs blood flow to the tissues. Okay, so we have the three layers of blood vessels or tunics. So we have the tunica intima, tunica media, and tunica adventitia. So ang tunica intima is the innermost. Makita nyo di, ang intima innermost. Change ta lang ang color. So innermost layer na siya, composed of endothelium consisting of simple squamous epithelium. So basement membrane and small amount of connective tissue. And the tunica media, middle layer naman siya. So ari siya, dira nga side. Pareho lang na ha. So middle layer na siya consists of smooth muscle cells arranged circularly around the blood vessels. And tunica adventitia, outermost layer. So, sagwa siya. Dira. So, outermost layer composed of dense connective tissue adjacent to the tunica media. Tissue becomes loose connective tissue toward the outer portion of blood vessel wall. So, okay. We have the three main types of blood vessels. We have the arteries, capillaries, and the veins. Okay. So, sa arteries, it composed of elastic, muscular, and arterioles. Ang elastic, largest diameter na siya and have thickest walls. Okay? So, ang function is elastic recall prevents blood pressure from falling rapidly and maintains blood flow while ventricles are relaxed. Okay, so sa muscular, medium size na sa or ginatawag nga distributing arteries. So, relatively thick and tunica intima has thin elastic connective tissue, contain smooth muscle tissue to control blood flow to different body regions. So, may kita ginatawag nga vasoconstriction kag vasodilation. Meaning, ang vasoconstriction ga constrict. So, decreases blood vessel diameter and blood flow. While sa vasodilation, nagdilate. So, relaxation of smooth muscles increases blood vessel diameter and blood flow. So, ang arterioles is it transport blood from small arteries to capillaries. So, smallest arteries adapted for vasodilation and vasoconstriction. And we have the capillaries. Okay, so sa capillaries, blood flow here from arterioles where the diffusion or exchange of gases, substances, and other waste products of or occurs between the blood and tissue fluid. So we have here sa capillaries is the precapillary sphincters. So ang capillary sphincters is smooth muscle cells located at the region of capillary branches that regulate the amount of blood flow through various sections of the network. So we have the veins. So ang veins, amo na siyang carry some blood towards the heart. So pakadto sa heart. So usually deoxygenated blood na siya, increase in diameter and decrease in number as progressing toward the heart, may be classified as venules, medium-sized veins, large-sized veins. Okay. So, ang venules, diameter slightly larger than capillaries. Okay, so ang medium size naman, predominant layer is the tunica adventitia that consists of dense collagen fibers, which determines the degree to which they can distend. So, next is the large size veins. So, diameter greater than 2 millimeter contain valves which ensure the flow of blood towards the heart and not the opposite direction. So, ang valves nga na sa large size veins is similar in shape to semilunar valves consisting of folds in tunica intima, so forming two flaps. Many valves also in medium-sized veins and lower limbs. Okay. So, ang arteries, mas larger siya sa veins ha. Okay? So, mas dako ang arteries kaysa sa veins. So, that's why, sometimes kung makuha kita dugo sa artery, gabusawak ni siya, kay dako ni siya, grabe ang pressure sa arteries naton. Okay? Compare sa veins. So, we have here the illustration sang aorta. Diba? Imagine na lang, diri ang heart. Ha? Okay, so 'di ba ang aorta sa babaw lang siya sa may lapit sa superior vena cava. So mani siya ang aorta. So where arteries of systemic circulation branch directly or indirectly. So may ara siya 3 parts. Ang ascending aorta, aortic arc, descending aorta, kag abdominal aorta. Sa ascending aorta, ari siya passes superiorly from left ventricle where the right and left coronary arteries arise from its base and supply blood to the heart. Ang aortic arc naman is carry blood to head and upper limbs where the brachiocephalic artery, left common carotid, left subclavian artery originate. Okay, so sa descending aorta. So descending aorta, longest part. So extends through thorax and abdomen to upper margin of the pelvis. So, divided na siya sa thoracic aorta. Thoracic aorta. So, ang thoracic aorta, may siya visceral arteries, parietal arteries. Okay? So, ang visceral artery supply the thoracic organs and ang parietal artery supply the thoracic walls. Next, we have the posterior intercostal arteries. So, extend between ribs, supply the intercostal muscles. Extend between the ribs, supply the intercostal muscles, vertebrae, spinal cord, and deep muscles of back. Then, superior splenic arteries supply the diaphragm. So, we have here the abdominal aorta. So, ang abdominal aorta is sa dalom na, sa may tiyan dapit na. So, extends from diaphragm to point at which it divides to common iliac. So, okay, ari sila. Nag-connect na sila. Like, ang mga unpaired branches, wala sila sang pair. Or mga visceral arteries ni sila. Okay? So, unpaired, wala sang pair. Ang celiac artery, superior mesenteric artery, inferior mesenteric artery. So, wala sila ha. Ga-supply sa stomach, supply sa small intestine, ga-supply blood to remainder of large intestine. So, ari naman sila ang mga paired. Okay, so ang renal arteries naton, suprarenal testicular arteries, ovarian, meaning may pair sila both side, right and left. And sa parietal arteries naman naton are divided into inferior phrenic arteries, so go-supply sa diaphragm, lumbar arteries, go-supply sa lumbar vertebrae and back muscle, median sacral artery, supplies the inferior vertebrae. So we have here the upper limbs. So for the arteries of head and neck, wala ko siya nabutang. I will send a video, a YouTube link para kami sila illustration sang head and neck ng mga arteries ha. Okay, so masend lang ko sang video. So upper limb, so we have the axillary. So ang axillary meaning lapit sa may armpit. Axillary ha, lapit sa may kilikili naton. So, ang axillary artery in the armpit branch off from subclavian artery located deep to clavicle. And the brachial artery. So, brachial artery branch off from axillary arteries where the blood pressure measurements are taken. And the ulnar artery. So branch off from brachial artery at the elbow, supply the forearm and hand. And the radial artery, branch off from brachial artery, supply the forearm and hand. Commonly used for taking a pulse. So, dira kita sa radial artery, gat lantaw, gina-feel naton ang pulse rate. Diba? Mas tudo siya, ma-feel nyo na. Okay. So, ang arteries of the pelvis naman kita. So, imagine this is the abdomen nga part. Okay. Pakadto na kita sa may hita. So, common iliac artery. So, ang common iliac artery, may ara external iliac artery kag internal iliac artery. So, sa external iliac, enters the lower limbs to supply the blood. Sa internal iliac naman, supplies the pelvic area. Okay? So, sa arteries of the lower limb naman is we have here the femoral artery. Sa may hita na dapit ha, femoral. So, dako ina siyang artery. So, branch off from external iliac artery supplies the thigh. So, ang popliteal sa may tuhod supplies the knee located in popliteal space. Ang anterior kag posterior tibial artery supply blood to the leg and foot. And the dorsalis pedis artery here is rise from anterior tibial artery that supplies the ankle. And lastly, the fibular artery or ang peroneal artery. Peroneal artery ha or fibular rise from posterior tibial artery that supplies the lateral leg and foot. So, ang femoral triangle gale, both sides ha, may femoral triangle, both sa sides sa may hita, dapit bala. Kung gabi ka, kung gatulok sa aton, nga side ni gatubang, ang view natin sang TL, sa may hita, amo na siyang ginatawag nga femoral triangle. So, ang femoral triangle is important access point for medical procedures and where pulse in femoral artery can be palpitated. So, located in superior and medial area of thigh. So, usually, ang femoral triangle, kung sa mga, like, di ba dako daring ugat natin sa femoral. So, sometimes yung mga ginakitawag kita nga sa dialysis, makita niyo may mga, aside sa IJ catheter, sa may jugular artery, or ang vein, may kita femoral. So, dira sometimes ginatakod or ginabutang ang femoral catheter. Okay? Kung mag-ano kita sa mga dialysis patient. So, hindi kita sina ang gabutang. Usually, doctor. Pero may mga areas, kita kay dako diri ang ugat sa femoral artery. Okay? So, next, we have the blood vessels of circulation. So, next, we have the veins. So, ang veins, mas dako ang artery sa veins natin, ha? So, na-mention ko naman na ang superior vena cava kag inferior vena cava. So, di ba, returns the oxygenated blood na sila. Okay, so, na-lesson ko naman sa previous natin nga, sa module 15. So, sa head and neck nakita nga veins. So, ang external jugular kag internal jugular vein. Ang brachiocephalic vein ha. So, example, ang sa superior ga-connect, kung already ang superior vena cava, ga-connect na ang brachiocephalic vein. Okay? So, sa external jugular vein, carry blood from posterior head and neck, emptying to subclavian veins. Ang internal jugular vein naman is carry blood from brain and anterior head, face, and neck, join the subclavian veins. So, sa upper limbs, so we have here the cephalic vein. So, it empties into axillary vein and basilic vein. So, basilic kagang axillary vein na diri nga side, sa may kilikili. Okay, so ang median cubital connects the cephalic vein and basilic vein. So, prominent on cubital fossa and often used as a site for drawing blood. So, dira kita usually gakuha sang dugo. Sa median cubital ang mga ABG naton, arterial blood gases, dira kita gakuha kay dako man na siya ang median cubital. So, dira always ang location, site of location, mag-draw kita blood. Or, sometimes, ga-cannulate man kita dira. Okay. Okay, so kung magluta ka mo, usually dira man, di ba, notice nyo, mga ginagluta, dira man inject. Dako, diri ang vein sa median cubital. So, the brachial vein, ang brachial vein naton, empty into the axillary vein. Okay, ha? So, the veins of the abdomen and pelvis. Okay. Ay, sorry. Sa veins of the thorax, gali. Veins of the thorax. So, we have right and left brachiocephalic vein. Right and left brachiocephalic vein. Okay, so major veins na siya that returns blood from thorax to superior vena cava. Okay, so makita nyo ha, superior, kung ari siya ang superior vena cava, ang right brachiocephalic ag left brachiocephalic, returns ang blood from thorax, returns ang blood from thorax to superior vena cava. Okay, so major veins na siya. So ang azygos vein, ang azygos vein is major vein na siya that return blood from thorax to superior vena cava. Okay, so connected pakad to sa superior vena cava, as you can see here. Then ang anterior intercostal veins, so ang anterior intercostal, so intercostal spaces na siya, sa intercostal spaces na siya makita just below the front of the rib. So wala lang ko di sang illustration. So next we have the internal thoracic vein. So deep in your chest na siya or sa thorax ang vein. So ang posterior intercostal drains blood from posterior thoracic wall and empty into azygos vein on the right side. So ang hemiazygos vein or ang accessory hemizygos vein. So drains blood from left side of posterior. So you can see, di ba, left na diri right. So drain blood from left side of posterior intercostal veins and empty into azygos vein. Okay. So veins of the abdomen and pelvis. So ang ascending lumbar veins, ari siya So we have left and right ascending lumbar vein. So blood from posterior abdominal wall returns to heart and drains into the azygos vein. So may mga common iliac veins kita sina sa abdomen and pelvis combined to form the inferior vena cava divided into internal iliac and external iliac vein. Wala kita So ang internal iliac vein, so return blood from pelvis. Okay? So ang sa external naman, drains blood from lower limbs. So ang renal vein, so ga-carry blood from kidneys. So kung ma-drawing kita di sang kidneys, ga-connect na siya sa kidneys naton. Ang suprarenal veins drains the adrenal glands. Ang testicular drain the testes in males, and ovarian veins drain the ovaries in females. So ang hepatic portal system. Ang hepatic portal system, vascular system that begins and ends with capillary in the viscera and ends with capillaries in liver. So, ang major vessels in this system are the splenic vein, the superior mesenteric vein, hepatic portal vein, and hepatic vein. So, ang splenic vein carries blood from spleen and pancreas. Ang superior mesenteric vein together with the inferior mesenteric vein that empties into splenic vein carry blood from the intestines. Ang hepatic portal vein forms by joining of splenic and superior mesenteric vein. Blood enters the liver containing rich nutrients collected from intestines and also toxic substances. And the hepatic vein drains blood from the liver and empty into inferior vena cava. Okay, so veins of the lower limbs. Amoy ni sila, ang great saphenous vein, small saphenous vein, and popliteal vein, and femoral vein. Okay? Sa lower limbs. So, ara naman ang meaning. So, blood pressure. So, meaning, ang blood pressure, measure of force blood exerts against the blood vessel walls. So, normal BP natin is 120/80. So need ni naton mabalaan ng blood pressure kay munigid aton nga basic nga himuon as nurses magkuha blood pressure. So mabalaan ta kung ga-hypotension na ang patient, nubo ya dugo or taas ang pressure sang dugo. Okay? So, ang systolic pressure is maximum force in which the blood is forced into arteries when ventricles contract. And ang diastolic pressure, diastolic, minimum value in which blood pressure falls when ventricles relax. Diba, hambal ko sa last module is ang SD. Diba? So, ang 120 is amo na siyang systolic, ang 80 amo na siya ang diastolic or ang sadalom. Ang systolic, ang first gid nga mabatian, mag-release ikaw sang sang aton nga blood pressure, magkuha kita blood pressure, and then may mabatian ka nga first nga sound, amo na siyang systolic, then manaog na siya, then ang last nga sound, ang diastolic na. So, auscultatory method used to determine BP with the use of sphygmomanometer or ang BP cuff naton. So, ginarap na siya around sa ton arm. Then, ang stethoscope gina-place sa brachial artery naton. Diba? Ang brachial, so kung makita mo na diba diri ang brachial ya. So, usually, diri nato na siya ginabutang. Muni aton brachial. So, diba, BP cuff ni siya. So, this, kung wari mo ni siya ang BP cuff naton. Okay, naka-cuff dira. So, ibutang tadi ang aton nga stethoscope, ang bilog na bala sa aton stethoscope para mabatian naton ang sound. Okay, mag-auscultate kita. So, ang carrot cough sound heard through stethoscope caused by turbulence from vibrations in the blood and surrounding tissue. So, first sound heard is the systolic pressure. The pressure at which the sound disappear is the diastolic pressure. Okay? So, ito sala ako na explanation gina ha. So, the pressure at which the sound disappear, mag-disappear bala, madula na ang sound nga. Usually, makita nyo na siya sa sphygmomanometer ninyo. Okay, fluctuate. Okay. So, tandaan lang ha, carrot cough sounds, muna siya mabatian during sa aton nga pag-take sa blood pressure. So, first sound heard is the systolic pressure. The pressure at which the sound disappear is the diastolic pressure. Okay ha? Pulse pressure, the difference between the systolic and diastolic pressure affects by two factors ang stroke volume naton. If increase the systolic pressure, increase as more than diastolic pressure. And the vascular compliance related to elasticity of blood vessel wall. So, ang pulse, pressure wave produced from ejection of blood from left ventricle into aorta can be felt at locations where large arteries are close to surface of body. So, vital for monitoring heart rate and rhythm. Okay, so mga bala yun na dapat kundi na mga pulso ta. Ang mga tudo na bala, ma-feel nyo gid. So, capillary exchange. So, most exchange across capillary wall occurs by diffusion. So, muna siya. You can read na lang ang capillary exchange. So, mechanism that control the blood flow through the tissues are classified as local, nervous, and hormonal control. Okay, so local control of blood flow achieved by relaxation and contraction of precapillary sphincters. So, ang relaxed sphincters increase blood flow through capillaries. Contracted sphincters decrease blood flow through capillaries. Okay? So, nervous and hormonal control of blood flow. So, meron kita vasomotor center kagang vasomotor tone. Ang vasomotor center naton area of lower pons and upper medulla oblongata that continually transmit a low frequency of action potentials. Two sympathetic nerve fibers control blood vessel diameter. And vasomotor tone, state of partial constriction of blood vessels. So next we have the mean arterial pressure or ang MAP or ang MAP, proportional to cardiac output times the peripheral resistance or resistance to blood flow in all blood vessels. So slightly less than average of systolic and diastolic pressure in aorta. So diastole lasts longer. So ang changes over time, ang MAP of 70 mmHg at birth and 95 mmHg in adolescence to middle age and 110 mmHg in health older person. So formula naton for the mean arterial pressure is cardiac output naton pulse rate. Cardiac output times pulse rate ha, or heart rate times stroke volume times pulse rate. Okay, so times lang ta. So diseases and disorder of blood vessels and circulation. So varicose veins. So varicose veins, very common. Makita yun siya kung permi kagat gatindog or bugat, kung heavy laban sa legs yun na siya makita, di ba? Lower limbs. So results when the veins of lower limbs become so dilated that the cusp of the valves no longer overlap to prevent the backflow of blood. So ang hemorrhoid. So hemorrhoids is makita na siya usually sa rectum or ang anus or ang ginatawag nga almoranas. Okay, ang hemorrhoid. So varicose veins of the rectum or anus. Phlebitis, inflammation of veins. So usually gakatabo na siya kung sa mga infected or example, nag-cannulate ka, na-infect na siya, nag-inflame ang veins naton. So usually mahubag na siya, di ba? For example, na out imo nga line. Sa cannulation mo, sige man Japon drip ang imo nga fluid out imo line. So nag-inflame aton nga veins. So mag-cause sang phlebitis. Hypertension, meaning high blood pressure. So amo ni ang kategory naton ha. So ari ila mga ang aton mga values for normal, pre-hypertension, stage 1 hypertension, and stage 2 hypertension. So depende ha kung diin na. So may mga classifications man na ang hypertension naton ha. So this is the normal gidya. So may ara kita sang arteriosclerosis. So ang arteriosclerosis, hardening of the arteries, making them less elastic than normal. Ang atherosclerosis naman, at arteryo ni siya ha, ang sa babaw. And this one is atherosclerosis. So results from deposition of fat-like substance contains cholesterol in the walls of arteries that form plaques, an age-related condition. Then ang edema, naghubag. So damo fluid. So results from disruption in the normal inwardly and outwardly directed pressure across the capillary walls. So may edema, so may fluid nga naga-build up. So Raynaud syndrome, treatable condition in which blood vessel in fingers and toes undergo exaggerated vasoconstriction in response to emotions or cold exposure. Okay? So that's all for the module 16. Okay. Thank you.